So we're going to talk about fibroids,
Yeah.
and the starting point is, what exactly are they?
Fibroids, yeah, well, everyone's heard of fibroids. Everybody, I'm sure, does not necessarily know what they are, but has heard about fibroids. And what fibroids are actually very simple issues. The uterus is a muscle, it's a muscular organ. And what happens is that some of these cells in the uterine muscle overgrows itself, so that they become full of fat and muscle. So they're called leiomyomas, the Italian name, because they're full of fat and muscle tissue. And they become look like an onion, because they're little whorls, they're a bit layer of fat, layer of muscle. And they grow from small little peas, little seedlings, and they can grow and grow and grow. So they can be a few millimetres in size, and obviously they can be 10, 15, 20 centimetres in size. So they can be really quite big, and they can be quite small. So to say you have fibroids is not uncommon, and it's probably about, these days with ultrasound scans, we can recognise fibroids in women very commonly. And if you look at women between the ages of 40 and 50, what the message is, it's about 40 to 50% of women, about half the women have got fibroids. So, and people get very excited about, oh, I've got fibroids, whereas in fact, you're more likely to have them than not if you're over the age of 40. Do they cause all 40-year-old women problems? Well, of course they don't. Essentially because women often don't know they've got them. So it can be a completely random event finding, these women get sent for a scan because they've got some bowel problem or bladder problem or kidney problem. And it suddenly said, gosh, you've got fibroids, did you know? And they say, no, I didn't know at all. And it scares them a bit because they don't know what they imagine about fibroids. But they somehow then we've got this concept that they're very dangerous. But they're benign. They're the most common benign tumour that humans get, because over 50% of women have got them. And so that's by far and away the largest tumour. Tumour is a scary word, I appreciate it, but they're benign, and we know
they're always benign.
Always, yeah. I mean, I always thought the old adage of rare as hen's teeth. Yeah, hen's teeth don't happen. Hens don't get them. Similarly, that getting malignant change in a fibroid is about the same likelihood of seeing a hen with teeth. So no. I can remember one case being presented, and I mean, after 35 years in gynecology, you see one case that's presented. So you might see one in a lifetime. But the fact that we see, or I see, fibroids in 5 women every single week throughout my whole life, and 1 in 35 years. So if you can get some sort of perception as to how uncommon it is. Mm-hmm. So they're benign, they don't need to, and therefore a lot of women who've got them, I'd advise them not to do anything about them. Just leave them well alone, because they don't make you become ill. They often don't cause you to have any menstrual problems. And there may be, and we all know once you go through the menopause and you stop having periods, they get smaller and they shrink and they shrivel up anyway. So they are passing by in your reproductive life, and they may not cause you any problems at all.
And how can you be certain that they're fibroids and not cancerous tumours?
Ultrasound scans and imaging is good. Ultrasound scans, MR scanning, CT scanning, all these imaging techniques we've got can identify the pelvic mass to be a fibroid, because obviously, if you've got a big lump in your tummy, for goodness sake, you go and get it checked, because you don't just think, oh, it must be a fibroid. That's a tough thing to suggest, because a big lump in your tummy obviously could be an ovarian cyst, and ovarian cysts, unfortunately, can be cancer. So when you do have a big lump in your tummy, for goodness sake, you've got to go and get it checked. That's number 1. 2, it's quite easy to have an ultrasound scan that can quite easily differentiate between an ovarian cyst and a big fibroid. And then it depends which of those it is, in terms of whether anything needs doing about it. And as I mentioned, whether it's actually causing you any symptoms or any problems. Symptoms of fibroids are common, as I've said, but it is possible that they may cause some issues.
What actually causes fibroids, and why do they occur in the first place?
Yeah.
And does anything make them better or worse? Is it like something you've done?
No, that's a good question. No, there's nothing. People always ask, is it because I've eaten this or done that, or I've been a bad girl or whatever? There's really nothing that makes you predict who's going to get them. We know they're racially associated with black Afro-Caribbeans. They're much more prevalent than in white Caucasians. Yes, they are. Asians are very common as well. But if I say it's 40-50% in white Caucasian, it's more like 70 or 80% in the Afro-Caribbean world. So they've all got them. and they can become very big, and they can get really quite massive. So there's nothing to predict who's going to get them. Bit of a familial tendency, yes, there is to a degree, but the racial association is probably the most common. In terms of, and there's nothing that you can do, diet or lifestyle, that's going to make you have them or not have them. Whether they're going to cause you problems then depends on where those fibroids are, in terms of where the fibroids are in the uterus in particular. Because if you can imagine, if you've got a fibroid on the inside part of the uterus, where the menstruation happens, where the lining of the uterus comes away, if you've got a big 3-4 centimetre fibroid on the inside part, that's going to make there's much more bleeding is going to happen. The periods are going to be horrendously heavy, obviously often a lot more painful, and by getting rid of that fibroid, which can be done these days with this hysteroscopic surgery where we look inside the uterus and shave the fibroid away, it's a fantastic cure, because it gets rid of the fibroid from being in the centre of the uterus, and it's women get better. It's a great cure. Obviously, if those ones on the inside cause those problems, fibroids stuck on the outside tend to be less of a problem.
On the outside of the uterus? On
the outside part, so they can be like stuck on the outside of the uterus. So they're not going to play any part in affecting a pregnancy, because the pregnancy is going in the middle part, and they're stuck on the outer aspect. They can get sometimes quite big and grow and grow and grow, and they can cause pressure symptoms, so they can give rise to bladder symptoms, so women are going for a wee all the time. They can sometimes affect the bowel and cause constipation, because they can block the passage of stool through the bowel. So there's all those issues that they can cause pressure symptoms, and they can cause just a big lump in the tummy. I mean, there's nothing worse than the women, if they are asked, am I pregnant? Whereas, no, I'm just this big lump that's a big fibroid. And you can tell it's a fibroid on examination and from the scanning that we can do. And then, what you want to do about it, as I say, depends on very much whether they're symptomatic or not. And I always warn a woman, because obviously she's got heavy periods, for inside the uterus, the bleeding's coming from inside, she's got a big fibroid on the outside, just taking that off probably won't make the periods any different at all, because it's really not impacting on her menstrual pattern by having a fibroid stuck on the outside, and that's very important for them to be aware of. But having said that, if you've got a big lump in your tummy and it's causing lots of pressure symptoms, to take it out and remove that fibroid is obviously the treatment. Mm-hmm. And historically, surgery has been the treatment. And historically, it's been through a proper cut in the tummy, and then you take out the fibroid. And obviously, it's very big. That's the way forward now. And there are lots of us who still practice an open myomectomy procedure for the very large fibroids, or women who've got multiple fibroids. So a lot of us do quite a lot of that surgery. You can these days take the fibroids out through keyhole surgery, so laparoscopic myomectomy can also be carried out. It's fine if you've got some smaller fibroids, and with a skilled gynaecologist. I think it's very important to know that the gynaecologist has done lots of them and is very skilled at doing it, because people can get into trouble with lots of heavy bleeding, because the fibroids can be very vascular, and the uterus is obviously very vascular, and so you can have lots of problems with bleeding. So if you're going to a trained laparoscopic surgeon for your myomectomy, that will be absolutely fine, but make sure that they've got a lot of experience, yeah.
Because one of the problems that could arise if you're inside the womb is that you could end up infertile, because you damaged the womb.
You could damage the uterus, you could, and well, I suppose one stage further than that actually, Kay, that if you bleed so much, we have to do hysterectomy. Oh. So, yeah, and the woman comes in thinking she's going to have a myomectomy, and actually then, because of the uncontrolled bleeding, and then you end up having the uterus taken away.
That's terrible.
I mean, yeah, I mean, it happened in my experience. I've never had that at all, which I'm thankful for, but you always have to warn a woman there's that potential before you have surgery these days, because it has to be the warning that's put about. But it is very, very uncommon if they're specifically treated well beforehand, and and it's a person who's got lots of experience. I think there's a lot of experience in the surgeon is very important.
And is there a medical approach to this as well, surgery?
Yeah. There are medications that you can use, and which are a bit of a short-term fix. I mean, there are medications, there are drugs, hormone therapy that we can give that will reduce the estrogen level, because they go in response to estrogen. So if you shrink the fibroids down by switching off their estrogen production, so there are hormone treatments that can be used, but they don't make them go. And you could have a 10 centimeter fibroid go to 8 centimeters, so 5 down to 4. So yeah, but they don't get rid of them, they don't cure them, they don't go. But they can give you a bit of a stopgap, and if they're big and they don't want to have surgery just yet, or they've got 2 or 3 fibroids that may be impacting on them getting pregnant, you could use that medical treatment for a few months to shrink them down to allow them hopefully to conceive.
And do they stop you from getting pregnant then? That is the case?
Well,
Or it can be.
I mean, I laugh because the evidence is both ways, because in the one hand I see women come into my antenatal clinic every week who are pregnant with fibroids, who often didn't know they've got fibroids, and they're coming on with their baby, they're 3 months pregnant, have a scan, and it shows the fibroids. So there's often those in my antenatal clinic, and then I see those women in my gynae clinic or fertility clinic who've got fibroids, been trying for 2 or 3 years. I take their fibroids out, and then they get pregnant straight away. So they must have been playing a part. So clinical evidence, is both that sometimes they do cause a part, and sometimes they don't go any part whatsoever. So generally speaking, it depends on the number and size of the fibroids as to whether you do anything about it. And quite often, so initially, if they're small and probably not playing a part in blocking their tubes or anything like that, you could leave them alone, because they usually don't cause a problem in pregnancy. They're often not associated with miscarriage, although it can occur, and they don't often cause any problems with delivery. I mean, in terms of they're stuck on the outside of the uterus, and as the pregnancy grows, they grow up as well, and therefore the fibroids don't get involved with the birth of the child.
But if it's in the womb,
if it's low down and if it's at the bottom of the outflow of the uterus, it can cause issues. But most fibroids don't cause a problem with delivery at all. In fact, it can be much harder thinking about a cesarean section if you've got the uterus full of all these big fibroids in the way, because it makes the surgical approach more difficult. So most of us would certainly consider that actually a vaginal delivery is far preferable in ladies who've got a fibroid uterus. This sometimes can cause a lot of pain for the woman during the pregnancy as they grow quickly in pregnancy.
The fibroids will grow along with the baby, will
so
they?
they can grow, they can. So you often start off a pregnancy and you've got a 4 or 5 centimetre fibroid, and by the time you get to 24 weeks, they've got to 10 centimetres. So they can grow, and sometimes with that growth, they can cause quite a bit of pain for the woman to experience. No negative effect on the baby, but it can be symptomatic for the woman carrying the pregnancy who can be in and out of hospital with a lot of pain. So those ladies that experience that, often once the baby's born, I would then plan to take their fibroids out after they've had their baby. So you tend to do a surgery 6 to 9 months after the baby's been born, and then they can have the fibroids removed. So surgery is the mainstay of treatment for fibroids, yes it is.
And not hysterectomy.
And not hysterectomy. No, you don't necessarily need to. But again, there are some women who come along at 41, 42, they've had their 4 children, they've been sterilised, or they're not going to have any more children at all ever, who've got big fibroids in the uterus, they've got awful periods, they've got some pelvic pain, and they just think, well, for goodness sake, I might as well have everything taken away, and I know I'm not going to be troubled by any more fibroids or problems in my periods later on in life, because they can recur. And I suppose the data there is about 1 in 4 women who have operations for the fibroids in their 30s will get more fibroids in their 40s and have to have more surgery by being conservative. So if women have completed
But that's less drastic surgery than a full hysterectomy, which comes with a whole load of psychological aspects.
It can be. I mean,
I don't know.
Yeah, well, no, psychologically, you can. Women don't often like to have hysterectomies. They don't. And certainly the Afro-Caribbean women in particular are very loath to have a hysterectomy at all costs, even if they don't think they're going to be using their uterus for having children. They're still really rather reluctant to have a hysterectomy. And that is why a myomectomy operation, removal of fibroids, is a very good surgical approach. It does,
even if it's a gigantic fibroid, you can still do it that way.
Still do it, you can, and save the uterus, because that's what the woman wants. And I think the management we've got direct up to the individual. And obviously you'd only do it if her quality of life has been affected by the fibroid, which is also very important. So a lot of them we don't need to deal with, but if they are a nuisance, and they can be, don't get me wrong, but they can be a big problem for some women, then I think surgery is the right way forward for them.
Good. Thank you very much.